We continue our working day in the UCMC. Now we'll be talking about the reform of the medicine, how hospital and primary care clinics will be transformed into clinics enterprises. Our speaker is Pavlo Kovtoniuk, Deputy Minister of Health of Ukraine. I would like to draw your attention to the what we have on the stage and hanging from the ceiling. That's the week of vaccination. Pavlo, the floor is yours. Please tell us about reforms. Good afternoon. Before we switch to the topic of a briefing, I again would like to draw your attention to these banners which are hanging from the ceiling. They talk about this week, which is the World Week of Support of Immunization. That's an international event which draws us attention to this important topic. We need to vaccinate our children so that our country becomes more healthy and our children are protected from different diseases. Unfortunately, Ukraine is an outsider in Europe talking about the coverage of vaccination. Now the situation's better a little bit, but we are still lagging behind. And our country in general should start working on that. We need to popularize it so that we live in civilized world just like other European countries, where the question whether to vaccinate children or not is not the question here. In Ukraine, we ask this question, and that is why I invite you to support all the flash mobs. I also support. I have this banner on my phone, and this is what many people now have. Now let's move to the topic of today's briefing. I would like to talk today about an important stage in medical reform, which is called reorganization, automation of medical institutions in our country. On the 13th of April this year, the Parliament passed the law on automation, and that means that the medical institutions become companies, organizations, just like other organizations around us. Before that, the medical institutions were budgetary institutions. They worked according to Soviet norms via vertical management. The head of the institution had no freedom, and he was using other norms.
And now the Parliament had made this important step, which is very much supported by the Ministry of Healthcare. That is, we are turning all the healthcare institutions in Ukraine into the enterprises. What does this actually mean, and what does the ministry wishes to support from today? So all the hospitals and primary care clinics will be involved. We had developed special guidelines and recommendations how this should be done. But first of all, why this step is needed? What does it mean that the hospital or a clinic will be turned into enterprises? The healthcare institution will become an enterprise which will be managed by the same administration. The Ministry of Health also owns some medical care institutions like the Institute of Cancer and other hospitals of the national level. As of today, all those institutions, all those healthcare institutions, they have to apply to the Ministry of Health for each small managerial step. For example, we wish to install a coffee machine in one of the primary care clinics for children and national clinics, and the director of this clinic has to submit an application about this to the Ministry of Health, which is stupid. This makes our healthcare institutions very, very unflexible. They are very rigid. They are very obsolete. They have very outdated equipment. The wages of medical personnel is very low, and actually this is very inefficient. Imagine the national healthcare primary care clinic for children. The issue was discussed whether we can put funny pictures on the walls in this children's clinic, and there was almost a scandal in the ministry around this. So it should be the Medicare institution which should be able to make decisions how to color the walls, how many coffee machines to put inside, how many beds should it have. The main rule is that all the doctors will have labor contracts with the healthcare institution. The healthcare institutions will have their own accounts in the state banks. These accounts will be protected since they will be in state banks, but nevertheless they will have separate current accounts. If any healthcare enterprise will have some saved money by the end of the year, then this very state might be, this very enterprise will be able to use the saved money at the end of the year. Then the salaries policy will be flexible. As of now, the doctors are split into the categories, and they get wages in line with these wage categories. As of now, the policy of wages will be established by the will be developed and implemented by the medical enterprises themselves. The chief doctor will become the manager. The law provides that the chief doctors in municipal and some other clinics will be elected. And some other measures designed to turn healthcare clinics into enterprises. The process will be complicated and rather long. There is some period when the clinics will have some privileged period, the period or transition period. By the end of 2018, we will have this transition period. This transition period provides for very simplified way how this budget hospitals and primary care clinics could be turned into enterprises. The Ministry of Health had developed these guidelines for medical institutions. These guidelines explain how to turn these state institutions into enterprise within 13 steps. These are 13 steps which are very clearly written for lawyers and administration. And now these guidelines are absolutely available from the Ministry of Health website. Having come back to my office after this briefing, I will sign up the letters to the regional healthcare units suggesting to start this reorganization process. And eventually, I would like to say that there are a lot of myths circulating around this step. The status of the clinic or hospital does not influence the quality of services, does not influence the dismissal or appointment of doctors. But this is nevertheless a very important step in Medicare reform, which would allow these enterprises to become efficient and to implement the new legislation which will soon be passed by the parliament. All the medical services later in line with that legislation will be implemented in line with the service contracts between healthcare institutions and the state. So, as the ministry, we are committed to assist all the healthcare institutions in transition from the state budget organization to become new enterprises and support them in many ways and to make it as quickly as possible. Now I am open to your questions. Now the Q&A session. Ukraine TV channel, Victoria Petrova. What will change for the patients in very simple terms, whether there will be the list of services with prices, price list, how it will change, etc. The draft law and this law about independence of healthcare institutions, it does not influence the price list of medical services. This very item will be regulated by the draft law, which is currently registered in the parliament. It contains the list of services, the list of medicines, which will be available free for the patients, and with indication of the sources, how could be additionally involved for coverage of Medicare services. As for the transition of this budget organizations into enterprises, this is needed to implement the further reform about service contracts, because now we are unable to conclude the service contracts with these state enterprises. Kyiv TV channel, Ivana Belichenko. a week ago in the Ukrainska Pravda, there was a decision, there was an article stating that this transformation will not be possible.
Most of medical institutions are owned by the community. The local self-governance is the owner. The municipality, the region, the district, they have the network of what we call medical institutions. That's why in Ukraine, local self-governance has more rights and we cannot force them. The decision is made by the council, but what does this law give them? It gives them the regime of privileges. During 2017, technically it will be very easy to switch to a new status. Then it will be more difficult. I will not tell you in detail what are the privileges. They are on the registration of property and others. This is a few times less paperwork, which is about transforming the institution from one form to another. That is why there's this privilege regime, and that is what is most, which is best for local authorities to do it within this time frame. They were not doing it because it was difficult. Now we open up the window for them so that it becomes easy for them. We simplify the decision making for them. Tell us if the hospital has its own account, how this medical institution is financed by the state, the money get to the account, how the medicines are procured, what are the councils. The medical institution has an account, but it's in the state treasury. For the money to get from there, the institution has to talk to the council and the national institution to the Ministry of Public Health. Now, when they have own accounts, the money will get to this account, and the institution could make the expenses. That is easier, and that does not affect the subordination. And but the decision on use of money doesn't require a so long administrative process. The more efforts you need to make, then the manager says, if I do nothing, then it's easier than if I try to do something. I'm sorry, what was your second question? It's on procurements and on supervisory boards. Once we're talking about procurement of the medicines by the institution, that's what is used in the work, and this will take place like it used to take place via Prozora system at the expense of this institution. The transparency doesn't change because there are different mechanisms, Prozora, then accountability to treasury and so on. And the money is still under state money. And the supervisory boards are set up by this law, according to this law, and this will be like a public control over the activity of the institution. We give more freedom and more control to enhance the responsibility. There's a mechanism of setting up the supervisory boards. The supervisory board has the right to participate in major decisions, and that's the normal civilized way. One more question. Zik TV channel. First question is on, again, funding. Now the medical institution becomes more autonomous. But just explain the mechanism of funding. The budget provides for funding. Is it for the patient? Is it for the bed? How will funding be taking place? Will there be some targeted money? That's for medicines, that's for repairs, that's for procurement of something else. How will it be happening? How will it be controlled? And who will be the member of the supervisory board? Answering your first question, this draft law does not introduce any new mechanism of funding, does not introduce the payment for medical services, but the medical institution, the hospital, will be able to work according to the new mechanism of funding when it's in place. But for that, the Parliament has to support the package of draft laws, which I mentioned. But this one prepares the institution so that they can work according to a new mechanism. If those draft laws are not passed, then the institutions will live as they used to. They will have more operational freedom in everyday decisions, but the money will not come for services. They will come according to the lines of the budget. They will be able to more freer distribute them between the lines of the budget. That's an important step, but it's not enough for everything to work properly. As to public councils, the main idea is that the patient should have the possibility to influence the decision making, so that people can participate in management of the hospital, which is on the territory of the community. We can compare that. With the supervisory board at Ahmedid, when people control every decision. That is the council which is more about treating the patients, and the public council is about the development of the institution. The director of the institution wants to open a new department, and the community says, we support you, you do it, and the patients say no, we don't want it, so they will influence some strategic decisions on the development of the institution. And I will read the question from those who watch us online. Who will make a decision on the changes in the state institutions? The decision will be made by the Ministry of Health. Basically, we are getting ready to start the process. I would like to mention that it will be very difficult for us. We'll have most of institutions, big national institutions and hospitals, but nevertheless we'll be doing it. As I mentioned, we are one of the supporters of the philosophy of switching to autonomous status, and we will do that to national institutions as well. Yemets Maria, UCMC. My question is, if this package of laws is passed, what will be the situation if some of the institutions have not switched to contracts, but there's this tariff system? How to pass this transitional period with less turbulence? The draft law that the Cabinet of Ministers submitted provide for a certain period to get adapted to a new system. There's a state guaranteed package of medical services. The payment for services will start working from 2019, and the medical institutions will have part of 2017 and 2018 to get prepared for that. the time frame is sufficient enough. We know that the process of switching to autonomous status takes about 6 months. The longest it's 6 months. Usually it's much shorter, so everyone will have time to do that. If this is not enough, that doesn't mean that the institutions will not have money, but they will not have many privileges that the new model of funding gives. So this is what will be happening. No more questions as of now. Thank you. Thank you. Our next briefing will take place in half an hour. Pavlo Petrenko and Pavlo Moroz from the Ministry of Justice of Ukraine.